we want to mobilize in a plane that's definitely in the plane of the glenoid fossa. So let's talk about posterior for a second. In this textbook, the person is mobilizing directly posteriorly, whether it be in a long axis technique or with a bent elbow. What I would recommend, based on some work we've done on CTs, is that the slope of the glenoid fossa going in a posterior direction is actually in this plane. So it's not that you would want to mobilize straight posterior, but rather you would want to mobilize in this plane, as you see here. So this is the plane you want to be in. You want to mobilize posteriorly, but you want to mobilize in a lateral direction. How much lateral? Well, this particular study we looked at in younger individuals, these are people between the ages of 21 and 35, that angle was on a mean 32 degrees. So that's the angle you want to be at, is 32 degrees lateral as you do your glide. Hi, we're at Champion Sports Medicine in the Performance Center. We're with Luke Wakefield, who's our Director of Athletic Performance, and Luke is going to go over some core stabilization and activation exercises. Luke?
Thank you. Today we're going to talk a little bit about anti-core. This is a style of training and principle that I'm a big fan of. I'm a huge believer in. A lot of the old school core training about sit-ups, crunches, leg raises, I'm kind of past that in this stage of my career, and I like to teach you guys a little bit about this anti-core training. So, my belief of core is that it's anything that we can use to stabilize the body in a natural posture. So, in this case, it's going to be shoulders, chest, back, abs, posterior chain, so glutes and hamstrings, and then hip flexors and quads also. If we look at the way the core moves, anything we do is trying to pull us up into a natural postural position. Anything we do, like sit-ups, crunches, where we're pulling through, we're pulling our body away from that. So anti-core, we're looking at bringing the core back into neutral. So we've got 4 different movements that we try and work with. We have anti-flexion, so preventing the body from coming down into this flex position. We've got anti-extension, preventing the body from coming backwards. We've got anti-lateral flexion, preventing the body coming side to side, and then anti-rotation also. We're going to hit about 2 or 3 exercises on each of these different groups just to give you guys a good idea of how to implement it and what sports to implement it with.
This particular month's installment is on treatment interventions and treatment modalities. What we'd like to do is set the stage with some of these modalities with a few PowerPoint slides. Then we'll go in the clinic and actually show how these modalities are used. So we're going right over the muscular tendinous junction, covering the area. So we've got about 2 minutes in, and again, not only do I treat the exact location of where he's feeling it, but I will go above and below, just trying to get a treatment area, so a treatment effect area, if you will. So he's giving me feedback as far as where he feels it the most as far as sensitivity, which is a guideline for the actual treatment. We want to hit the most sensitive area, treating it for maybe a couple minutes and then backing off of it as well. And Morrison, the spot is right there. So I'm going to, through palpation, and plus I've been treating him now for a little bit with this problem, so I'm going to try to isolate as best I can. Put the pad right on that spot. As we talked about. And then basically just turn the device on.